Hello, in this video we're going to be talking about mental health and mental illness and how we can tell the difference between one and the other, and also the different tools that we use to diagnose that. Okay, and we'll have our first look at the biopsychosocial model. So let's get into it. So it's important that we need to understand that mental health and mental illness are part of a continuum. Basically, is that, and this is what I've talked about in class before, is that you will have certain things where you like your books really neat, or you don't like people touching you, or there's lots of different things, little things that people have where people will automatically say, oh, you've got OCD, or you've got whatever, some sort of other crazy mental illness. It's not the case, okay? There are different sorts of behaviors and thoughts and feelings that occur to make up different human beings, and what we need to understand is that there is a continuum, okay, where those thoughts and feelings, behaviors get to such a point where you can no longer function, and that is where we are looking at mental illness, okay? So let's have a look here at this little diagram here. On the left it says mental health. That's where you have the capacity to interact with other people, you cope effectively with things, and you don't completely lose the plot when you get stressed out. Now, you're coming into a very stressful time. Most of you will have the coping strategies to deal with this fine. Okay, you'll get stressed out, you'll get angry, you'll get grumpy, you'll eat too much, you won't eat enough, you will sleep too much, you won't sleep enough, all of those things, but you'll get past it. Okay, that's due to the mental health. Okay, you move along the continuum and you find yourself perhaps in the throes of a mental health problem. And statistically, 1 in 5 people will find themselves here at some point. Well, even more. Okay? This is when it all gets a bit too much. Okay? The difficulties experienced by a person are mild, they're temporary, okay, and they can be treated in a short period of time. Some of you may have already been through this, some of you will definitely go through this at some point in your life. But it's important to remember that they are relatively mild, that it is temporary, and that it is very treatable in a short period of time. Okay, this could be a depressive episode, this could be an anxious episode, something like that. Okay. Then if you move right along into the dark blue area of mental illness, you can see there that we are looking at the mental illness as you know it. Okay, it is psychological dysfunction, usually involves impairment of ability to cope. Your thoughts, feelings, and behaviors are abnormal. In the last video we talked about normal and abnormal. Okay, so there we use the word atypical, but that's pretty much the same as saying abnormal. Okay, and they are inappropriate within your culture. Okay, but really important to remember, it involves impairment. Okay, and you cannot function. These are really, really big issues. Okay, and they are abnormal or inappropriate within your culture. You can see here on the left, people who are mentally healthy can do the following things: cope with stress, experience pleasure and joy. People with a mental health problem can feel tense, they can feel low, they can feel irritable, they can get confused and angry. They sometimes have a loss of energy or motivation. Sometimes they feel like things are different or they're different. Okay, and they have trouble concentrating. But a person with mental illness, they have full-on coping issues, full-on function issues. So this is the key. Psychological dysfunction is a breakdown in cognitive, emotional, or behavioral functioning. You cannot function. Cannot do what you normally want to do. Cannot stress that enough. It's about function. Can this person get out of bed? On your exam, they might give you something to do with a scenario where Peter cannot get out of bed, or he can't go to work anymore, or he can't do a whole bunch of things. That would be a clue that we're looking at dysfunction here. Okay? Or when the boss asks Sally to work back late, she completely falls in a heap and bursts into tears and rocks herself in the corner. I mean, these are not normal ways of coping with a small amount of stress. So, what do we look for? Well, again, it's dysfunction. Is there distress? Okay, is there extreme or unreasonable unhappiness? Is there an impairment, inability to cope with everyday life? People say, I can't go on, I can't do this anymore, I'm giving up. Those kinds of ideas. Are there atypical thoughts, feelings, or behaviors? That idea of abnormality. And are those thoughts, feelings, or behaviors not acceptable in the culture that you're in. So, when we're looking at mental health, we're looking at the biopsychosocial framework. What does that mean? Well, you've got bio, which is your biology. You've got psycho, which is your psychology or your cognition. And then you have social, which is the support networks around you and the people that you deal with. So that is the biopsychosocial framework. So from this slide, you can see some of the things more specific that fall under each category. So psychological, your ability to learn, your memory, your emotions, your perceptions, your thinking, your beliefs, your attitudes, your stress management strategies. These are all psychological, okay? If you pair that with some of the biological things, so your genetic predisposition, so we know that mental illness or anxiety and those things can be passed down hereditarily, okay, through the genes. Okay, your neurochemistry, if you have any medication that you're on, the functioning of your HPA axis, we're going to talk a little bit about that later, but you should already know that, and also the ability of your fight-flight response to kick in times of stress. And finally, social supports, family background, interpersonal relationships, cultural traditions, socioeconomic status, poverty, physical exercise. That's a big one. You should be doing that during your exam period. Make sure that you exercise. Also, things like biofeedback and medical care, which we'll talk about in the stress video. Biopsychosocial framework looks at a holistic view of health, meaning the whole person. Okay? Individuals considered as a whole person functioning in a unique environment. Okay? E.g. depression, some people might have a biological disposition to that. Also, that might be exacerbated by the trigger of a breakup or parents' divorce or something like that. And if you don't have the right skills to cope, then you might struggle and you might fall into a depressive episode. Okay? And that's how those three work in looking at mental illness. So how do we know? How do we know if you've got a mental illness or not, or what's going on with you if you do not feel normal or you do not feel mentally healthy? Well, we classify mental disorders in a couple of different ways. First of all, we have the categorical approach, which organizes mental disorders into categories. Simple. Categorical approach, they're in categories. And they each have specific symptoms and specific characteristics. Okay? So the diagnosis involves a comparison of patients' symptoms to the listed symptoms within each category. So we're just looking here at symptoms. Can we classify you? What are you in? Tell me what's wrong with you. This, and this. Well, that means if I check my list over here, right? Or more specifically, if I check the DSM-4 and you tick enough boxes, then you have this disorder. Simple enough. The dimensional approach looks at a whole bunch of symptoms, gives them numerical order, and gives you basically where you fit on a continuum of functionality. And we're going to talk about that a little bit later as well. Which is the best? Well, hard to say. Often both of them are used at the same time. As I said before, categorical approach looks at symptoms. Dimensional approach looks at the severity of the symptoms. So, the categorical approach, what is it? Well, famously known because of the manual that they use. There are two different manuals, we're going to look at them both. But the categorical approach assumes that mental disorders can be diagnosed from specific symptoms that are reported by the patient or observed by the professional. It's like going to the doctor and saying, my nose is runny, my body aches, my head is sore, and I can't stop sneezing and coughing, and they say, well, with all of those symptoms, it looks like you have the flu. Thoughts, feelings, and behaviors can be categorized. Certain characterizations or categorizations relate to specific disorders. Okay, and there are distinct subcategories of disorders within each major disorder area. All right. What is important to note that it's all or nothing. You can't have kind of have schizophrenia. You can't kind of have schizophrenia. You have schizophrenia or you don't. Okay. Also, for this system to work, it must be valid and reliable, and the diagnostic tools that they use have been tested and tested and retested and retested a lot. Okay. So valid means accurately diagnoses the mental disorders, and reliable means that different professionals should be able to look at the same patient and come to the same diagnosis. That's your little diagnostic statistic manual of mental disorders, or the DSM-4 revisited. There is a DSM-5, but you don't need to know about that just yet. There it is. It's important to note that it does not suggest causes, okay? Just simply names and describes the symptoms. There are 365 disorders comprehensively described. They're in 16 different categories, okay? They tell you about how the disorder will progress. They tell you the age it most likely is to kick in. They will tell you how much impairment, how common it is in society, and they will also tell you the influences of gender, age, and culture. So you get some idea of what's to come, okay? There is inclusion criteria, so the person who comes to the clinic, they must have these symptoms. They also must not have done certain other things, okay? We call that exclusion criteria, so have not slept for more than 6 hours for the last month, something like that, okay? And it has polythetic criteria, which means only some symptoms, not all, need to be present. So, for example, 3 of the following 8, okay? It has 5 different axes. It's important that you know that. Here are the axes. You have clinical disorders on axis 1. Okay, so that's all the things that you need to know, like is it depression, is it bipolar, is it trichotillomania, those kinds of things. Axis 2, we have personality disorders and mental retardation. These are not necessarily the clinical disorders that you are aware of, although they do highly factor into behavior. For example, are there chronic enduring problems that generally persist throughout life and impair thoughts? For example, does someone have such a low IQ that they can't really understand what's going on in the world around them? That would be axis 2. Axis 3, if I'm looking at this person, are there other characteristics, are there other things at play here? Do they have a physical disorder? Do they have some other medical disorder that could impair their functioning and also lead to something like that? So for example, if you got really, really sick and you, say with diabetes, and you had to lose one of your limbs, then that might contribute to the fact that you got depression straight after. Axis 4, Axis 5, not really as important for us to know about. Talks about potential stresses in life that may be relevant. That's the psychosocial bit. Again, talking about the biopsychosocial model. And finally, a global assessment of functioning. Can this person function overall in society? And that's what we were talking about earlier, about mental illness being dysfunction. The other way we do it is the ICD-10. This is basically the DSM-4, except it's the European version, and it's a lot more succinct and usually found itself in a medical journal for most doctors around the world, but now is its own standalone publication. It looks at detailed descriptions of each disorder and its symptoms, okay, the same as the DSM-4. The original text covered all medical practice, okay, and it was originally just one chapter and now is its own thing. It's less detailed than the DSM-4, so it doesn't deal about prognosis, it doesn't deal about prevalence or anything like that, just symptoms, okay? So that's important. So the strengths and the weaknesses of the categorical approach. Well, strengths are based on rigorous scientific research that is regularly revised. It's comprehensive and it has, heaps and heaps of disorders. It also allows for diagnosis and treatment plans because it talks about prevalence and the course of a disorder. It's user-friendly and it also helps communicate between professionals. It has a common language. So a doctor in Melbourne and a doctor in France or a doctor in Connecticut, they all have the same set of things to use to deal with. The weaknesses are, well, it has low inter-rater reliability. What does that mean? Well, you know how we said down the bottom that professionals have the same kind of language? The problem is that sometimes mental health professionals can look at the same person and come to different conclusions. They can say, well, I don't know about that. Maybe that's a symptom, maybe that's not a symptom, or not ask the right questions. So that's improved over time. They're significantly better at it now, but that was originally a weakness. Okay, that's something you're going to need to know. Inter-rater. So the rater is the person who's rating you on whether you have the symptoms or not, and whether insert between means between, which means between the two people rating you. So if you go to one psychologist and you go to a different psychologist, sometimes there can be some confusion, but not really so much anymore. Also, there is overlap between symptoms. Okay, so if you have a general anxiety disorder or something other anxiety disorder like agoraphobia, the symptoms are very similar in both, and that goes back to that inter-rater reliability. Also, it doesn't take into account individual differences between people, and that's something we'll talk about with the dimensional model. Finally, one of the issues with this is that once you get your diagnosis, it says you have depression or you have schizophrenia. And the problem is that it can cause stigma, which is a socially undesirable label. Okay, so the person has schizophrenia, so stay away from them. And that can be a cause of distress for the person who's suffering. Now we have the dimensional approach. Okay, so this is looking at mental illness on a spectrum. Okay, so it quantifies a person's symptoms and other characteristics with numerical values or on continuums. So it doesn't say you have anxiety, it doesn't say you have depression, it says on this rating you're quite high. And we're going to look at a picture of that in a minute. One of the things that it says is that a dimension is viewed as a cluster of related psychological behavior or characteristics that occur together. For example, extroversion. And you may have done those tests where you're an extrovert or an introvert. Myers-Briggs is a very popular one, and you may have done that online or done it on Facebook. Also, the values are compared with the statistically normal expected values for each characteristic. Okay, so a low score means there's low impairment, and a high score means high impairment. Okay, we're going to look at that in a minute as well. Eysank's pen model. This is the idea that we were talking about before, looking at extroverted or introverted as well as stable and neurotic. You can see there, basically, if you ended up answering a whole bunch of questions and it turned out that you were in the top left-hand corner, you would be an introverted neurotic person, which means that you are moody, you're anxious, you're rigid, you don't change your mind very often, you're pessimistic, you're reserved, you're unsociable and quiet. But if you answered the questions and got similar answers but a little bit further down, you're introverted and stable, you wouldn't be moody, you'd be passive, you wouldn't be, you'd be even-tempered, you wouldn't be anxious, you'd be controlled, you wouldn't be pessimistic, you'd be peaceful, and so on. Okay, so you get a sense of where you might fit in this continuum. So the dimensional approach focuses on severity of issues rather than categorizing you. It also allows you to monitor any change. So if you start to get better through any sort of treatment, you can see that over time. And this is what it looks like. If we look at the person in the blue, they are scoring quite heavily. You can see there that the light blue, all the way up to about 65, is relatively normal. In terms of the scale that we're looking at. But beyond that, where it says clinically significant range, that's where you start to get worried. So what we can see here is that this person rates very highly on depression. They rate pretty highly on hysteria. Okay, they rate very highly on the masculinity or femininity scale and very highly on the psychasthenia scale. Now, we don't need to know too much about that, but you can see that after treatment, that person has progressed to the left. So they are still progressing quite well. They are improving. They are now no longer in what we would call the clinically significant or the mental illness range. Okay, and they seem to be getting quite better. Okay, they do seem to be getting a little bit more paranoid and a little bit more, let's say, manic or over-the-top energetic, but that could be due to a number of factors. But this is how we look at it. So no stigma here. No one says, you've got depression. No one says, you've got, some sort of gender identity issue. It just says, this is where you fit. Let's work on some treatment to help you out. So the strengths and weaknesses of the dimensional approach are: it accounts for more than just the categorical approach, so more factors are talked about. Also, it's more detailed on each symptom, okay? And it reduces stigma, as I said before, no dirty labels. The weaknesses are, though, there is no standard inventory to compare scores. Okay, so there's no real diagnosis yet of saying if you have this score, blah, 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 you have this illness. So that can make it hard. Also, because of the amount of tests that you need to do, it can be quite time consuming. And finally, there is disagreement among people that use this about the number of dimensions that represent mental disorder symptoms. So, are there enough dimensions to represent all the symptoms that people face? So, overall, that's mental health and mental illness in a pretty quick nutshell. What we need to understand is to be mentally healthy, you need to be in the middle of the biopsychosocial framework. Have your biological systems working well for you, have your social networks working well for you, and have keeping yourself psychologically healthy by being able to cope with stress and learning and improving your memory and those kinds of things. All of those things clump together to make a happy bunny in the middle. All right. Once you move out of that, then you move into psychological dysfunction, and that's where we start to look at mental health issues and mental illness. Okay. Same way that we look at it with physical health and physical illness. Okay. I hope that helps. The next video is going to be stress. That's also a bit of a long one, but hopefully not too long. Thanks for listening, and keep studying.